Hey Milligan, welcome to the Taylor House Counseling Center. I'm here with Dr. Christine Browning, Professor of Counseling, and we're in one of our counseling rooms here at the Taylor House. And today we're talking about a very important topic, which is suicide. And we're doing this for Suicide Awareness Month because it's a topic and an issue that many people have dealt with and deal with, and so we want to have a conversation with our entire campus. So, Dr. Browning, if you wouldn't care to start just by telling us a little bit about suicide.
Okay. Suicide is an emotion that people have, so maybe thoughts or feelings they're having when they're down and maybe having feelings of worthlessness or hopelessness. So they're dark feelings, dark thoughts, dark emotions that are associated with suicide.
What should I do as a member of the campus community if there's someone in my sphere, there's someone around me who I feel might be suicidal, might be thinking about killing themselves?
One of the most important things to do is to ask, are you thinking of hurting yourself? Some people think that will cause the individual to think more about suicide or more about harming themselves or ending their life, but in fact it validates what they're feeling. It validates those dark thoughts or that dark mood, and essentially says to that person, I see you.
So asking the question doesn't put them in danger, doesn't increase their risk at all. It affirms where they're at.
Right, because they're thinking those thoughts anyway. That's all that's on their mind, which is why they're having suicidal thoughts, maybe even plans of how they might do that. So by asking them, are you thinking of hurting yourself? What you're doing is saying, I see you and I care about you.
So if that friend responds with a yes, or if someone listening themselves has thoughts or feelings of suicide, what's the next step?
Okay, so if you're a friend of someone who's having thoughts or feelings of suicide, as I said before, ask. And if they say, yes, I am having those kinds of thoughts, then show interest. Listen to them, take them seriously, never try to cajole them out of their emotions. And then there are people on campus who you could help that person seek help with. One of them is the counseling center. One of those places is a counseling center. Another place are the
Our RAs?
Yes, the RAs. Thank you. that are trained to handle such situations. So you could go with the person and with their permission, helping them understand that this is very serious and they need to talk to someone else that knows more about it, that can get them help. And so to go to an RA or to come to the counseling center, to call the counseling center. If you are a person who's thinking those thoughts, then I would encourage you to seek someone out. For example, a friend or an RA, or make an appointment with the counseling center to talk to someone about what you're feeling, what you're experiencing, because we do care about you, and we know that people do have those thoughts, emotions, behaviors, that there can be times of just desperation and hopelessness, and I want you to understand that we are here to help you.
Awesome. Well, thank you so much for that good and very relevant information for us. Campus community, I hope you know that you're loved and that there's help for you if you need it. So speak up and step out to get that help. Be well, and we'll see you later.